Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Have you ever wondered what causes a fractured clavicle? Our clavicle or collarbone is a key player in our bodies, offering strength and support to our upper limbs. Despite its robust nature, it's prone to fractures, an injury that doesn't discriminate, striking people of all ages. But what causes it? Are there certain signs to be aware of? How do we diagnose it? What could be the potential complications? How is it treated, and can it be prevented? In the next few minutes, we will explore these questions. So, what exactly causes a fractured clavicle? Let's dive in. The clavicle, or collarbone as it's commonly known, is one of the most frequently fractured bones in the human body. This is due to its location and relative exposure. It acts as a strut between the shoulder blade and the sternum, making it vulnerable to impact. A fractured clavicle can occur in a variety of ways. Perhaps the most common is a fall onto an outstretched hand or directly onto the shoulder. This can happen in everyday situations, such as slipping on ice or tumbling off a bicycle. Sports injuries are another significant cause. A hard tackle in football, a collision in hockey, or a rough landing in gymnastics can all result in a broken collarbone. And of course, car accidents. The force of a collision can easily fracture this bone, especially in situations where the shoulder hits the dashboard or steering wheel. Now that you know the causes, let's move on to the signs and symptoms. If you've had a fall or impact, how do you know if your clavicle is fractured? A fractured clavicle can present itself in a variety of ways. The most immediate and common symptom is pain, which can be sharp or dull, and usually intensifies when you try to move your arm. Swelling often follows as the body's response to injury kicks in. This swelling can extend to the surrounding areas, including the shoulder. Don't be surprised if you notice bruising too. This is caused by blood from the damaged blood vessels pooling under the skin. But perhaps the most telltale sign of a clavicle fracture is a visible deformity or bump over the break. This can sometimes be felt as a lump or ridge on the collarbone. Also, you might find it difficult, if not impossible, to move your arm, especially across your body. Seeing these signs should prompt you to seek medical attention for a proper diagnosis. How is a fractured clavicle diagnosed, and what complications can arise? Well, typically, diagnosis involves a physical examination where the doctor assesses pain and checks for any deformities. This is often followed by X-rays to confirm the fracture and determine its severity. But what about complications? There are a few that can arise. One potential complication is nerve or blood vessel damage. This can occur if the broken bone fragments injure nearby nerves or vessels, leading to numbness, weakness, or even a lack of blood flow. Another complication could be non-union of the bones, where the broken pieces fail to grow back together. This can cause chronic pain and may require further treatment. Lastly, there's a risk of lung injury. This is rare, but if the sharp end of a fractured clavicle pierces the lung, it can cause serious problems. With a diagnosis in hand, the next step is treatment. What does treatment for a fractured clavicle look like, and how can you prevent such injuries? Let's dive in. Treatment for a fractured clavicle usually begins with arm support. A simple arm sling or figure-8 wrap is often used to keep the arm and shoulder in place while the bone heals. This is typically followed by pain relief measures, which could be as simple as over-the-counter painkillers. In some cases, prescription medication may be required to manage more severe discomfort. Beyond this, physical therapy is a crucial part of the recovery process. It helps restore movement and strength to the shoulder, reducing the risk of long-term complications. A physical therapist will guide you through a series of exercises tailored to your specific needs and recovery timeline. In more severe cases, surgery may be necessary. This could involve placing plates, screws, or pins to hold the bone together while it heals. The decision to undergo surgery is based on several factors, including the type of fracture, your overall health, and your personal preferences. Now let's talk prevention. Wearing protective gear during high-impact sports is a good start. This can reduce the risk of injury, including clavicle fractures. Additionally, always using seat belts in vehicles can prevent trauma to the clavicle in case of accidents. Remember, prevention is always better than cure. Stay safe and take care of your health. To summarize, a fractured clavicle is a common but treatable injury. From sports accidents to falls, the causes are varied, as are the signs like pain and limited movement. Diagnosis often involves X-rays, and complications can range from nerve damage to lung injury, but with timely treatment, be it surgery or immobilization, and preventative measures such as using protective gear, the outlook is generally good. Now you're well equipped with knowledge about fractured clavicles. Share this information with others and help create a healthier community. UMCC, your ultimate medical consultant connector.